Your family, your health, our passion. This is Family Practice with Dr. Jeffrey Fox, sponsored by Family Practice Associates of Lexington, PSC. Visit us at fpalex.com and like us on Facebook.
Welcome back. My next guest is Dr. James Winkley, who is a neurologist with Baptist Health Neurology. Welcome.
Thank you, Jeff.
Now, I mentioned forgetfulness, and a lot of my patients come in and worry about dementia, and myself, I think, boy, my memory's just not what it used to be. Is there something that's abnormal forgetfulness or might be symptoms of dementia that we need to worry about?
Yeah, so the biggest question we get, we have a lot of people kind of the worried, well, like you said, when do I need to be worried? And a lot of times people will be concerned about they have trouble recalling something or they can get it and they say, well, I'm having memory problems, when that's actually sort of an attention and concentration. You have it, you can retrieve it, but it's there. Stress, lack of sleep, lots of things like that can affect it. What we really focus on is when people are having trouble remembering things at all, like they're not even sure something has happened, or a common thing that they've been able to do repeatedly, they are then not able to do it, getting lost in familiar environments, forgetting to pay bills, which they would never do, a recipe that someone would make over and over now no longer can remember it. So or activities at work where they really care about their job and now they're losing the ability to do tasks and people are noticing that they're not able to do it. A lot of times people are not as attentive at home, or stress is at home, and spouses will be concerned about that they're not remembering things as well. But you really think about the important things and being able to carry those out as a warning sign that someone is starting to have a definite memory problem.
Now, I use the term dementia, and Alzheimer's is the big one, but there's other things that cause memory problems.
Correct. And so dementia is a big term as far as a progressive degenerative condition of the brain. And so you see other types of dementia, but then you also see patients have what we call vascular dementia, where they'll have blood vessel disease, recurrent strokes. Sometimes patients can fall and hit their head. They can have blood clots that develop. So there's a number of things structurally that happen. So whenever we're evaluating people, we always like to make sure we get an image to make sure that there isn't anything structurally wrong with their brain. We look for things like thyroid deficiency, B12 deficiency, or other metabolic conditions which can affect their memory. And people also are on a number of medications that at times can start to affect their memory, and we see that a lot. And patients will always say, well, I've been on this medication for years, and the medication doesn't change, but you're changing. And the way you respond to that changes a great deal as you get older.
Okay. Are there certain people who are at risk for dementia?
Yes, and so patients who have increased risk factors that we all think about, high blood pressure, diabetes, high cholesterol, smoking, obesity, and sleep apnea all increase your risk for dementia.
Genetics?
Genetics, absolutely.
Now, is there treatment? Is there anything you can do, or is there anything you can do to prevent it?
Well, the best thing to do is to lead a healthy lifestyle and exercise. And so exercise has been the only thing that's shown to be disease modifying, meaning it slows the progression, and also having an active, engaged lifestyle. And so a lot of times we see people talking about they want to do brain games and things like that, but really it's the interaction that you gain from dealing with people, solving the problems as you work with someone. So volunteering and getting out and doing activities, whether that's gardening or a hobby that it causes you to be engaged with. And the key thing is use it. So use your brain, be engaged, and get out and get active.
Better to wear out than rust out.
Exactly.
Okay. Now, are there medications you can take?
Correct. There are some medications, but unfortunately we've had a real dearth of these development. And there was a drug that was released earlier last year that was intended to be disease modifying, but there's been a number of controversies that's come up with this about whether it really is. We have essentially medications that help ease the person down as they're having progressive memory loss. Things like donepezil, memantine, and a number of others in that class, which can provide some benefit. Unfortunately, they don't address the disease as much as we would like.
Now, one other thing, you also deal with Parkinson's disease, and Parkinson's can cause dementia also.
Yeah, so Parkinson's is also a degenerative condition of the brain. So it will present as a tremor, slowing down of movements, rigidity, and trouble with balance, but the patients will also sometimes start to get vivid dreaming. At times can have visual hallucinations from the condition, and will start to have memory loss. And we'll see anywhere from about 40 to 60% of those patients start to develop cognitive complaints that go along with the physical complaints.
Well, that's great information. We appreciate you coming in, and again, thank you for the work you do also.
Thank you.
All right, so if you want to avoid dementia, stay active. We'll be right back.